Would you mind to like and subscribe to keep it free for others? You too can send your results.
The question.
I've got measured it multiple times during last 6 months and differences was about 15 tilde cc. The initial MRI showed 21 cc. The TRUS showed 36 cc. The other TRUS showed 30 cc and the last one 27 cc. Plus all of the urologists said that the sizes changes back and forth depends on position, abstinence and sport activity. All of these measures were done without any active inflammation or symptoms. I'm 30 years old, so which one of these measurements should be taken as a real one?
Professional explanations. 4. Ordinary people.
Results interpretation.
All sizes of yours are of gray zone, which can't be a cancer and may be inflammation of mild degree or just normal. Let's start to explain. How does TRUS measure prostate size and what factors affect the correct measurement? How does TRUS measure prostate size and what factors affect the correct measurement? Transrectal ultrasonography, TRUS, measures prostate size by using sound waves to create an image of the prostate gland. Here's how it works. A small, lubricated probe is inserted into the rectum. This probe emits sound waves that bounce off the prostate and surrounding tissues. The sound waves are captured and converted into images on a monitor. These images show the prostate's size, shape, and any abnormalities. The prostate volume is typically calculated using the ellipsoid formula, which requires measurements of the prostate's length, width, and height in different planes. Several factors can affect the accuracy of TRUS measurements. The experience of the examiner can significantly impact the accuracy of the measurements. More experienced examiners tend to produce more reliable results. A full bladder can obscure the prostate and affect the accuracy of the measurements. Larger prostates can be more challenging to measure accurately due to their irregular shapes. The technique used, including the positioning of the probe and the planes in which measurements are taken, can influence the results. How does MRI measure prostate size and what factors affect the correct measurement? MRI, magnetic resonance imaging, measures prostate size using high-resolution images generated by magnetic fields and radio waves. Here's how it works. Multiparametric MRI, MPMRI. This type of MRI combines different imaging sequences, such as T2-weighted images, diffusion-weighted images, DWI, and dynamic contrast-enhanced, DCE, images, to provide detailed information about the prostate. Image acquisition. The patient lies on a table that slides into a large, cylindrical magnet. The MRI machine captures images from multiple angles, providing a comprehensive view of the prostate. Volume calculation. The prostate volume is calculated using the ellipsoid formula, which requires measurements of the prostate's length, width, and height in different planes. Several factors can affect the accuracy of MRI measurements. Standardized imaging protocols and techniques are crucial for accurate measurements. Variations in how the MRI is performed can lead to inconsistencies. The experience and skill of the radiologist interpreting the images can impact the accuracy of the measurements. Proper patient preparation, such as having a full bladder, can improve image quality and measurement accuracy. The presence of benign conditions like prostatitis or BPH can affect the clarity of the images and the accuracy of the measurements. High-quality images with good spatial resolution and signal-to-noise ratio are essential for accurate measurements. What are differences between MRI and TRUS in measuring the prostate size, and what's the efficacy degree in diagnosis of malignancy by prostate size? Differences between MRI and TRUS in measuring prostate size. Imaging technique. TRUS. Uses sound waves to create images of the prostate through a probe inserted into the rectum. MRI uses magnetic fields and radio waves to produce high-resolution images of the prostate. Accuracy. TRUS generally underestimates prostate volume, especially for larger prostates. MRI more accurate and consistent in measuring prostate volume, particularly for larger prostates. Image quality. TRUS provides lower resolution images compared to MRI. MRI offers higher resolution images, which can better delineate prostate boundaries and detect abnormalities. Usage. TRUS commonly used for guiding prostate biopsies and measuring prostate volume during routine checkups. MRI often used for detailed imaging, especially in cases where more precise information is needed, such as detecting prostate cancer or evaluating complex cases. Efficacy in diagnosing malignancy by prostate size. Larger prostate size can sometimes be associated with a higher likelihood of prostate cancer, but size alone is not a definitive indicator. MRI, especially multiparametric MRI, MPMRI, is highly effective in detecting prostate cancer, with high sensitivity and specificity. TRUS is less accurate in detecting cancer compared to MRI. Using both TRUS and MRI can improve diagnostic accuracy, as MRI can provide detailed images and TRUS can guide biopsies to specific areas of concern.
Bloodtestsresults.com. Happy to help. Bloodtestsresults.com. Happy to help.